A health savings account can help you curb medical costs, cut taxes, and plan for retirement. And with us today to discuss the ins and outs of HSAs is Begonya Klumb, who is the head of HSA at Fidelity Investments. Thanks for joining us today, Begonya.
Thank you for having me with you.
So, who ideally do these accounts benefit the most as far as those who are nearing retirement or younger workers who clearly stand to benefit from that longer time horizon?
These accounts can benefit anyone for whom a high deductible health plan with eligible for opening an HSA is a good option. And you can obviously, if you're a younger individual, you can invest for a longer time into your account and make the most out of those accounts. But it could be as helpful for someone who's nearing retirement to start savings in for healthcare expenses, that they may incur today or when they are in retirement, because as we all know, the healthcare expenses will be very high in retirement. And in fact, Fidelity estimates that the average 65-year-old couple retiring today will require $280,000 in healthcare expenses alone in retirement. So, at any age, I think if it is a good plan for you, it's a good idea to open your HSA and start saving towards those expenses.
Right. Clearly, this is very important here. And as far as prioritizing maxing out a 401k and investing in the HSA, which one should you focus on, or should you try to do both at the same time if possible? How should people be prioritizing these investments?
Absolutely, everyone should do as much as they can do in terms of contributing to their retirement savings, both to their 401k and to their HSAs. The HSAs are unique in that they have this triple tax advantage, which is unique to the HSAs. The money that you contribute to the account is tax-free. It grows tax-free, and if you withdraw it for eligible expenses, it is tax-free, which is something that is very unique to HSAs and no other account has. So when you're thinking about saving for your healthcare expenses, for example, in retirement, there would be HSAs would be a very effective tax efficient tool to save towards those expenses. We actually in 2018 introduced a tool, a digital decision-making tool for our end customers to help them actually think about how to contribute to a 401k or a defined contribution account that they may have through their employer, and to an HSA if they also have it available through their employer. Fidelity has a point of view as to how to prioritize the contributions, because not everyone has enough money to save to contribute to the maximum amount allowable for both the defined contribution and the HSA. So we have prioritized those savings, and depending on how much you have to contribute, depending on how much you estimate your healthcare expenses to be, your deductible, for example, or out-of-pocket maximum, etc. Our tools, our decision-making tools, will help individuals make those decisions and define how to contribute to one account or the other while maximizing their tax savings.
Interesting. And clearly, it's just beyond health savings. That investing aspect makes HSAs very compelling, along with that triple tax advantage. And with all of the investment options available now through HSAs, how active would you say investors are getting with their self-directed HSA brokerage accounts through Fidelity?
Well, actually, the lack of investment, I would say, unfortunately, about 1/3 of investors don't realize that they can invest their HSA dollars. So that's there's definitely a gap, and in fact, that's reflected in industry-wide. The average is about 4.5, less than 5% of account holders who are actively investing their HSA dollars. At Fidelity, fortunately, that number is higher because we are very focused on helping individuals invest, and it's close to 9% of our account holders who invest. But as you can see, there's still a big gap in trying to get those HSA account owners to invest and make the most out of those HSA dollars, which can grow much more if you invest those over time, especially if you have a retirement investment horizon.
Right. So clearly there's a knowledge gap here. What do you think would help to close that gap?
We think it is education, and that's really some of the things that Fidelity HSA is very focused on, is in providing very effective education, leveraging our thought leadership that, as you know, Fidelity has a tremendous amount of, and then providing the right guidance and tools, personalized communications to really raise awareness of how much people need to save for healthcare expenses in retirement, and also how they can invest those dollars. And obviously, we also continue to improve our investment experience. Last year, for example, we introduced the Fidelity HSA funds to consider is a set of 25 curated mutual funds, both active, passive, open architecture, with no minimum to invest, no transaction fees, to make it even easier for investors to decide where to invest in. And as well, we introduced a tool to automate the investment so that when individuals get contributions in our from their employers, those contributions are automatically invested based on their decisions on allocation.
Interesting. And can you tell me a little bit about the mix between employer HSAs and the individual accounts, which Fidelity relatively recently started offering? What led to that decision, and what would you say is driving the growth, not only for Fidelity, but in the industry as far as corporate versus individual accounts?
Yes, so Fidelity has seen the need and kind of within our mission to help individuals reach financial security in retirement. HSAs fits very well within that objective. So we launched last year the retail HSA offering, which allows individuals who are not tied or associated with an employer, or maybe their employer is not offering an HSA, giving them the opportunity to have an HSA. And in terms of growth in the industry, we're seeing significant growth in the industry. In fact, in 2018, the industry grew by about 19%. Fidelity grew about 37%. Our HSA assets. So you can see certainly
Yes.
a positive trend in growth in terms of adoption of these retirement savings vehicles, but as I said, there's still a lot to go, a lot of room to go to
Right.
improve and get the individuals to maximize. In terms of what is driving the growth, in my opinion, high deductible health plans together with an HSA can be an effective tool to manage rising healthcare expenses for both employers and employees. And as we, in the industry, continue to raise the visibility of those benefits, I think that we will continue to see more adoption going forward.
Great. And with that triple tax advantage that you mentioned earlier, tax filing season is upon us. So, what considerations should Americans be thinking about in terms of their HSA as they are filing their taxes?
Well, remember that the maximum contribution is $7,000 in 2019, and actually $6,900 for 2018, and for the family plans, and about half of that for the individual plans. And I think that for individuals to know that they can contribute still to their HSA, make a 2018 contribution up to tax filing date. So until April 15th, they will be able to make their HSA contribution for 2018. So if they didn't think about it in 2018 and they still have room to go to max out that contribution, they still have an opportunity to do so.
Great. And Fidelity ranks among IBD's best HSA account providers with awards in all 5 of our categories, which not many others can say. And those categories are investment options, investment quality, low fees, interest rates, and easy access. And clearly these category awards are very telling in everything that we've talked about so far here. But what else would you say makes Fidelity's HSA offering stand out from the other providers out there?
Well, certainly we have a very robust investment offering. As I mentioned, we have the open full brokerage platform, which has more than 10,000 mutual funds, stocks, bonds, etc., available to our HSA account owners. We also provided this the Fidelity HSA funds to consider, which is a curated list of 25 mutual funds for those individuals that still may want to have a more selected list, a more narrow list to choose from. And later this year, for example, we'll be introducing an HSA investment advice option as well for those individuals. And in addition to our robust investment offering, I would say we are very focused on providing the right education, raising awareness of the benefits of these accounts, and providing those digital tools. I mentioned a couple of examples of the things that we're doing in the digital decision making or support tool space, and with all the idea of helping people prioritize healthcare savings for both today and in the future.
Right, and the benefits are very compelling, so I'm sure there's a lot of growth to be seen. We really do thank you for sharing your advice with us today, Begonya.
Thank you very much for having me.
And thank you all for watching. Make sure to check out IBD's Best HSA special report at investors.com and on newsstands the week of March 18th. For Investors Business Daily, I'm Alyssa Corum.
Hey everyone, thanks so much for watching Investors Business Daily on YouTube.
If you want to watch more videos, make sure you hit that subscribe button so you don't miss a thing.